All right, now let's put our hand together for tonight webinar MC, Charlie.
All right, good evening, ladies and gentlemen. All right, before I begin, let me start by thanking the EVG and my upline for bringing nutritional immunology into my life. Okay, my name is Charlie, your MC for tonight's Together We Beat Diabetes webinar. So before we begin, I'm sure you already noticed that. Okay, let me wait for the AV team to put out the announcement. Okay, all right. So I'm sure you have noticed that all your mics are put on mute, right? So to prevent any interruption to the meeting. So we thank you for your cooperation. In the midst of this presentation, okay, you can actually use the chat box, okay, to actually interact with us. And also, there will be a portion whereby there's a Q&A segment. You can actually use the chat function to actually raise your question into the chat box, or you can unmute your mic to ask your question directly. A lot of slides will be presented throughout this presentation. Okay, if you're using your mobile to view, you can actually maximize your viewing pleasure by zooming in, so you can actually see the slides much better. So once again, I want to thank every one of you, right, for attending tonight's webinar. Okay, tonight is Together We Beat Diabetes. In fact, diabetes is a dreadful disease. Okay, the dreadful part being is kind of like an illness magnet. Okay, in other words, okay, when a person comes down with diabetes, then all the other illnesses are actually not far away. Okay, illnesses like heart attack and stroke, which will increase by 2 to 3 folds as compared to a healthy person. Okay, cancer and autoimmune disease will also be increased, and also the person will lead to blindness, and it is also the leading cause of kidney failure. So have you actually ever wondered why diabetic, right, fear of getting physical cuts on their body? The reason being is that if the wounds don't heal, then they might have to be amputated. And also, diabetic often worried about consuming food that are sweet in nature. So does that mean that they actually cannot consume food that are actually sweet? And also, are there any chances of recovery if a person are diagnosed to be diabetic? Now, I'm sure all these questions, right, goes on in a lot of people's mind. Okay, tonight, okay, we have a speaker whom is well-versed in nutritional immunology to present to us this topic. So now, let's put our hands together to welcome Ms. Teo Eileen.
Hello, good evening, everyone. First of all, I would like to thank EV Global Network as well as my upline. I'm Eileen. So tonight, I'm very happy to be able to share with you on this topic on Together We Beat Diabetes. So I'm sure many of us have heard about diabetes, right? So diabetes is actually a metabolic disease. Okay, diabetes occurs when a pancreas does not produce enough insulin, or the body cannot effectively use the insulin that is produced. So let me just share some of my slides before we begin. All right, so let's take a look at these alarming figures. The number of people with diabetes is increasing significantly. And just in 2019 alone, there are 4.2 million deaths due to diabetes. And there is about 463 million have diabetes. This is not including 232 million people who were undiagnosed. And according to scientists, by 2045, there will be about 700 million people will have diabetes. Okay, and according to statistics, 11.3% of Singaporeans actually suffered from diabetes. And it is estimated that the number of type 2 diabetes will increase to about 25% in 2025. So doctors can actually diagnose it by measuring the blood sugar level. So let us take a look at the common tests to test for diabetes. Okay, so there are 2 tests here. First is the FPG test. We call it the fasting plasma glucose test. So we will need to actually check our blood sugar level on an empty stomach, meaning that we have to fast for 8 to 10 hours. Okay, so the normal reading is actually between 3.9 to 6. Okay, the reading between 6.1 to 6.9, this person could have already have this pre-diabetes. All right. And then if the reading is already above 7, that means that the person could have already have this diabetes. So to be more accurate on the test on whether, you know, this person has diabetes, okay, the person can move on to do this test called OGTT, the oral glucose tolerance test. All right, so normal results for the normal range, right, is actually below 7.8. Pre-diabetes is actually 7.8 to 11. And anything above 11 would mean that this person have already diagnosed with this type 2 diabetes, or if let's say for a pregnant woman, the person is diagnosed with this gestational diabetes. So how does our body actually maintain a normal sugar level? Okay, so first, let's get to know about our pancreas. All right, so taking a look at the picture on the left, can you see this one in beige that has a leaf shape? Okay, so this is our pancreas, which is actually sitting just below the stomach. All right, so one of the function of pancreas is to secrete insulin. So talking about blood sugar level, right? So what happens is that when we eat, and the food will be actually broken down into glucose. So this glucose is in yellow. So glucose will then enter the bloodstream. Okay, and during this process, the pancreas will then secrete the insulin that is the one in white, okay, in order for the cells to absorb the glucose for the body to be able to convert it to energy. Okay, but how does insulin function to lower the blood sugar level? All right, so let's take a look. Okay, so we can see over here, these yellow particles over here on the left. Okay, so these are the glucose in the blood. Okay, so the one in green over here, that looks like a key, right? Okay, so these are the insulin that is secreted by the pancreas. All right, so this insulin, right, is like the key to open the door of our cells. So our cells is the one in blue. So when the insulin can open the door of the cells, then glucose can enter our cells. That is when, you know, our body has the energy. Okay, but if one's pancreas, right, does not produce enough insulin, or the cells do not respond properly to the insulin, just like this picture on the right, that's when you see all these yellow particles, which is our glucose, will start to deposit in the bloodstream, causing the blood sugar level to rise. And with this, right, long-term uncontrolled high sugar level becomes diabetes. Okay, so just now, you know, I mentioned about the normal fasting blood sugar reading, right, is between 3.9 to 6. Then you may ask me, you know, if I don't eat, will my blood sugar be too low? Okay, so let's understand about our pancreas. In fact, you know, our pancreas has these cells, okay, we call it the islet cell, pancreatic islet cells. So inside, right, we have 3 types of cells in the pancreas. That is the beta cells, alpha cells, as well as the delta cells. So let us take a look at these two, right? Beta and alpha cells, okay, secrete hormones to balance the blood sugar in the body. So let us take a deeper understanding. For beta cells, right, over here, you can see that it's between 60 to 80% of our inside our pancreas. Okay, so it helps to secrete insulin. As for alpha cells, right, it is about 24 to 40% in our pancreas, and it helps to secrete this hormone called glucagon. Okay, so it works in opposite way to the insulin, okay, where it is a hormone that helps to increase the blood sugar in the blood. And then we have these delta cells over here that is about 6% to 15% in our pancreas, okay, that helps to actually secrete this growth hormone called the somatostatin. All right, so that is to help us to adjust our beta and our alpha cells. Okay, so let us take a look at how the beta cells and the alpha cells actually balance the blood sugar in the blood sugar level in the body. So over here, this part is talking about the beta cells. All right, so you know when we take in food, we start to have a lot of glucose in the upper blood vessels. Okay, that is when you know when we eat, there will be this glucose. So these beta cells will then produce this insulin, okay, for our cells to absorb the glucose. In this way, right, our blood sugar level will be normalized. Okay, how about the one on the left? Okay, let's say, have you tried before, you know, when you are so busy and you have no time to eat, and when you feel really, really hungry, sometimes you will feel like, you know, you're sweating or you have like shaky hands, okay? From this part, right, these alpha cells will then secrete this hormone called the glucagon, okay, which I mentioned just now. And this hormone will actually prompt our liver to release glucose. keeping our blood sugar level between 3.9 to 6. However, we have to take note that it is not possible to not eat regularly for a long period of time, because otherwise, our body will no longer be able to maintain the balance. Okay, so talking about diabetes, right? Actually, there are 3 types of diabetes. Okay, first one is a type 1 diabetes, where the pancreas produces little or no insulin at all. Okay, the second one is type 2 diabetes, where the body does not use insulin properly or does not produce enough of it. Okay, and then that is where we have this gestational diabetes, for a pregnant woman. Who usually some pregnant women do diagnose with gestational diabetes. Okay, it happens when hormone changes that will actually cause this insulin resistance. So let us take a look, a deeper understanding on the individual diabetes, the types of diabetes. So first one is type 1 diabetes. Okay, this is irreversible, and it is usually prevalent among children and young adults where they are actually born with. And this accounts for about 6% of all cases of diagnosed diabetes in the United States. So type 1 diabetes, right, is a hereditary, or it is an autoimmune disease, okay, where the immune system will cause destruction of the cells in the pancreas. Without those cells in the pancreas will mean that, it is not able to produce insulin, or maybe just producing just a little of it. And that is why, right, in order for these children and young adults to survive, okay, insulin injections is required, right? So let us understand what is gestational diabetes. Okay, gestational diabetes is reversible and can be prevented. Okay, so what happened is that, during pregnancy, right? So for the pregnant mothers, there will be this hormone that will be made by the placenta, which will actually prevent the body from using the insulin effectively. All right, so causing this thing called the insulin resistance. Okay, meaning that they can produce, okay, the pancreas can produce the insulin, but the body cannot produce it effectively. And this usually occurs between 24th and 28th weeks of pregnancy. And for gestational diabetes, right, it accounts for about 2 to 10% of pregnancy in the United States. And the high risk cause for this, the major risk cause for this is actually obesity. So how does a pregnant woman know that, she is overweight? So we can actually follow this by World Health Organization, this BMI standard range. Anything that is above 25 is actually overweight, okay? And the BMI above 30 is already obese. All right, so over here, maybe I would like to share a bit more. Many people have a concept that, mothers cannot exercise when they are pregnant as it increases the risk of miscarriage. Okay, this is not true, all right? In fact, exercise helps to lower the miscarriage risk. Imagine a pregnant mommy, right, not exercising for 10 months and thinking that, they have to eat for 2, they may end up overeating. So if let's say they eat all the high fat, high calorie food, I think it is very easy to put on weight and even eventually become obese. Okay, so what pregnant mommies really need are like nutritious food to actually boost their immune system. And it is very important for them to keep their weight in check because like I mentioned, obesity increases the risk of gestational diabetes. So gestational diabetes also has several health impacts on newborns as well. So let's take a look at the first point here. Actually, there will be an excess growth of the baby that is more than 4 kg. And this will actually increase the risk of injury during delivery by the mommy. Okay, and also the newborn may experience low blood sugar. Okay, what happened is that, after delivery, right, the baby, although already left the mother's body, but the baby continued to have a high insulin level, thinking that, it needs to actually neutralize the glucose level, but it no longer has the high level of sugar from its mother already. So a newborn may experience this low blood sugar, and some newborn babies may have like jaundice, seizures. And also what is more worrying is that these newborns may have increased risk of type 2 diabetes in the future. Okay, so many people think that, oh, gestational diabetes only occur like during pregnancy, right? But it has a huge impact on the mother later on, like hypertension, okay, meaning high blood pressure, and this proteinuria, okay, this is a high level of protein in the urine, affecting the eyes as well, visual impairment, swelling in the face, abdominal pain, and even difficulty in delivering, with a higher chance of C-section. And also experts, have pointed out that half of those, okay, who have diabetes, okay, will move on to develop type 2 diabetes after 5 to 10 years after their delivery. So next, let's take a look at what is type 2 diabetes. Okay, so type 2 diabetes, okay, can be prevented as well and is reversible. All right, so it is a metabolic disorder, okay, where the body does not use insulin effectively or the pancreas does not produce enough insulin. And take a look here, type 2 diabetes actually accounts for 91% of all diagnosed cases of diabetes in the United States. And I can say that, research has shown that it is possible to develop diabetes from the age of 30 to 40. So let's take a look at what is the main cause. Okay, first is excess body weight, okay, which is one of the main cause. And then because of sedentary lifestyle, lack of physical activity and exercise. All right, so let's take a look at this picture to understand further. All right, so let's take a look. So this is one with the normal weight, and this one is the one that is obese. All right, so the one with the normal weight, right, do not have much fats. Okay, if you can see over here, the one in pink is the fats. So the insulin, right, binds with the insulin receptor easily because it helps to open the cell walls for the glucose to enter. Okay, but take a look at the one that is obese. Okay, that's quite a lot of fats, Basically, there's a layer of fats actually blocking the insulin from binding to the insulin receptor. So, when this happens, right, glucose remains in the bloodstream. That is why it will lead to this high blood sugar level. Therefore, right, obesity is a main factor that causes the body to be not able to actually use insulin effectively. That's why leading to type 2 diabetes. Maybe some people will tell you that, hey, I'm diagnosed with diabetes after I have lost weight. Why is this so? So remember at my first slide, I did mention that there are about 232 million people that I mentioned who were actually undiagnosed. So that's why, right, diabetes, when the cells are unable to take in the glucose for a long period of time, right, the body will then start to burn the body fats, our body fats and the protein for survival. So in this way, right, a person will start to lose weight. That's why since diabetes symptoms, one of it is actually weight loss. But there are also several other symptoms, for example, excessive urination. Let's say, for type 1 diabetes, right, the body is not able to produce insulin at all. So our body will send a signal that, oh, you have no insulin, I'm going to get rid of the glucose through the urine. So that is why, right, a type 1 diabetic patient will start to lose a lot of water. That's when, they feel thirsty very easily. And also they will get hungry easily as well. Okay, and it comes together with this weight loss because, the body cells are already starving as they can't use the glucose. All right. And also one person will also feel tired because the body cannot get to have the fuel or the energy it needs. And it can also affect the visual as well, the vision, leading to blindness, and also experience the numbness or tingling hands or feet. Slower healing, meaning that there will be a high, more prone to actually infection, or even sometimes at the early stages, there may not be any symptoms or not. But of course, we start to observe all these signs and symptoms. If you have one or more of these symptoms, you should get it checked already because there's a high chance of getting type 2 diabetes. All right. And okay, so many people around me actually, in fact, and some diabetic patients, they will start to avoid food that are sweet. Okay. But sometimes they still cannot control their blood sugar level. In fact, right, food don't need to taste sweet to cause a rise in the blood sugar level. Rather, it is the glycemic index of the food we should pay attention to. So let's take a look at what is this glycemic index. So in short, I call it the GI. So later on, you will keep hearing from me GI. Okay, so it means glycemic index. All right, so GI is actually an indicator on how quickly, the body can digest a particular food and convert it to blood sugar. So the lower the GI, all right, the slower the food causes a rise in the blood sugar level and the healthier it is. Okay, so food that has greater than 70 are considered to be high GI food. Take for example, does rice taste sweet? No, right? But take a look over here, the GI is 89. How about cooked potatoes? Do they taste sweet either? No, okay? But the GI is also very high at 87. But let's take a look at this red apple. Red apple tastes very sweet, right? We do eat very sweet apples. Okay, but the GI is very low, just 34. So in conclusion, right, it is not the sweet foods that cause the blood sugar level to rise, but the food with high glycemic index, all right? Okay, so diabetic patients should really choose a low GI diet over unsweetened foods. Okay, but talking about sugar, right? Actually, there are many different types of sugar as well, and they have different GI levels too. So take a look at glucose. Okay, it has a highest, okay, at 100. So we should really avoid it because it really immediately raises our blood sugar level. Okay, and then there is sucrose, that is a GI of 65, and then lactose 46. What about fructose? Okay, fructose has a GI of 19, which is very low, meaning to say that, fructose does not cause a person's blood sugar level to rise immediately. So friends out there who like to eat desserts, you can consider using fructose to make them instead. Okay, so maybe sometimes you may hear some reports, talking about, hey, fructose has high GI, but why is it so? Okay, so this is the answer. Okay, because in the market, there are many beverages in the market have added this thing called the fructose corn syrup. Although it has fructose, but it is not pure fructose. And this is actually one of the cheapest sweetener. All right, so let us take a look at some of the, in the market, the common ratio it has, 42% fructose to 58% glucose, and 55% fructose to 45% of glucose. So you see over here, the GI is definitely higher than fructose. So just now I mentioned fructose, the pure fructose is only just 19. All right, so in addition to controlling your weight and paying attention to the GI of your diet, okay, what other groups of people are at higher risk of developing diabetes? Okay, so we must really take note, who are the high risk groups? All right, first will be because of family history, especially just now I mentioned about type 1 diabetes. It is actually mostly hereditary. And if let's say a parent or a sibling have diabetes, also has an increased risk as well. So also women who have gestational diabetes, people who lack exercise, all right, and also people who are obese. Okay, and also for certain races like the American Indians, Asian Americans, Pacific Islanders, Hispanics, and Latinos. Okay, and people with hypertension as well, high blood pressure. Okay, that means their reading is 140/90 or higher. All right, and also those with high cholesterol and high triglyceride levels as well. And also statistics have shown that, 1 in 5 people over the age of 65 has diabetes. Okay, why is this so? Because maybe due to aging, there will be a gradual loss in the muscle mass and leading to an increase in body fats. Okay, so this can also lead to diabetes as well. And also for COVID-19 survivors. So you may ask, how come COVID-19 survivors? Okay, so one of the long COVID symptoms is actually diabetes. So studies have found that, those infected beta cells in the pancreas of COVID-19 survivors produces less insulin. And that is why, there are some survivors develop diabetes soon after recovery. And the concerning thing about diabetes is not the disease itself, but the various complications it causes. And basically, right, diabetes can cause damage to almost every organ in the body. So let us take a look at what are the health impacts diabetes have. Okay, so firstly, right, it will lead to a lowered immune function, meaning that the overall defense, cleanse, and repair functions of the immune system is greatly reduced, thereby increasing the risk of cancer and autoimmune diseases. All right, so as you know, our blood actually flows throughout the body. So imagine that there is high sugar in the blood for a long period of time. Basically, right, this high sugar in the blood will damage every part of the body because, blood flow throughout the body. And that is why when our blood vessels are damaged, right, it actually increases the risk of atherosclerosis, where the plate actually are prone to actually build up in the artery walls. And that is why you will see that there is a 2 to 3-fold increased risk of having these heart attacks and stroke. And then the next thing is this nerve damage as well. Okay, perhaps the patients start to get numbness, tingling, or pain, and even loss of sensation of the limbs. Okay, and with not enough blood flow to the area, right, this will actually lead to an increased risk of infection due to slower healing. And then the next concerning health impact is also this diabetic retinopathy. Okay, this actually causes blindness, and 2.6 of the global blindness is actually due to this condition. All right, and diabetes is also the leading cause of kidney failure as well. So according to the Singapore National Kidney Foundation, 67% of new cases of kidney failure are due to diabetes. All right, so it can have a lot of life-threatening illnesses. Okay, and what are some of the other complications as well, like the limb amputation? Okay, because slower healing and faced with a higher risk of infection. Okay, so this may happen. And also because one is more prone to this bacterial or even fungi infection that will lead to skin problem, hearing loss, Alzheimer's disease, depression, dental problems, and also difficulty in getting pregnant. Okay, so what are the medical treatment for diabetes? So for type 1 diabetes, it's quite straightforward. The patient needs a lifetime of insulin injection in order to survive. Next, for gestational diabetes, all right, insulin injections are recommended, oral medications are not. And then lastly would be this type 2 diabetes. They will first start on oral medication. So when the medications are no longer effective, doctors will then recommend this insulin injection. So of course, you know, these oral medication do come with serious side effects like anemia, fractures, and even heart failure. Okay, so most diabetes can be reversed, especially type 2 diabetes, because prevention is always better than cure. So how can we actually reverse it? Okay, the best way, of course, is to start to go for regular checkups. Okay, especially, you know, people with symptoms of diabetes, like just now I mentioned the symptoms. So we have to go and study it and see if we have such symptoms, and then we should start going for regular checks. And then people who are overweight that I keep mentioning just now. So it's really very important for us to keep our weight in check. Okay, and all the high risk group of diabetes that I mentioned just now as well. And especially if, let's say, you are 45 years old and above, then you need to start going for regular checkup already. Because after all, early detection of any diseases is always easier to receive the appropriate treatment, okay, to control and even reverse this condition. And diabetes can also be reversed if, let's say, we detect it early. So besides, you know, all these regular checkup, what other superfoods are effective in reversing diabetes? So let's take a look at the first one is psyllium husk. Okay, so the first is psyllium husk that is very rich in dietary fiber. Okay, fiber cannot be digested and also cannot be absorbed. So it has no calories at all. So it is very helpful for weight loss and also blood sugar control. And you know, just there is about 78 grams of fiber per 100 grams of psyllium husk, and it has about 70% soluble fiber and 30% of soluble fiber. So what does soluble fiber do? It helps to lower cholesterol and control the rise of blood sugar, and insoluble fiber help to slow down the absorption of carbohydrate and help blood control. Let's take a look at this very amazing research that has shown that, you know, if let's say, you know, if one takes 5.8 grams of psyllium husk twice daily, that is before breakfast, before dinner, there is a significant reduction in blood sugar concentration after meals. So it's very important to actually include psyllium husk in daily diet. And then the next superfood is soy. Okay, so American Diabetes Association has actually recommended soy protein for diabetics, all right? Because comparing with animal protein, right? So soy protein has a protein level 2 times more than meat, 3 times more than eggs, and 12 times more than milk. And, you know, just now I mentioned about lactose. Lactose GI in milk is 46, but take a look at soy. It's just between 10 to 23, so it's very low. And also soy help to increase the body's sensitivity to insulin, okay? That means we say that it can help to control this blood sugar level very effectively. And the soluble fiber in soy helps to improve blood sugar control. Okay, you know, studies have shown that, you know, eating soy every day is as effective as a drug for diabetes. All right, so we don't miss soy in our daily diet as well. And soy, also has a very good benefit, that is it contains a very active polypeptide, okay, that will help to speed up the fat decomposition process and help to reduce body weight, and that is when we can better decrease the risk of diabetes. Okay, and importantly, okay, it has no burden on the kidneys. As a result, complication of kidney disease can be reduced. Okay, let's take a look at the next one. Next superfood will be cactus. All right, so studies have shown that cacti can actually increase the sensitivity of cells to insulin, which can help to reduce blood sugar level in diabetes. All right, so there is this 8-week study in rats have shown that diabetic rats treated with both insulin and cactus actually have a normal glucose level after 2 weeks, that means the same as those in the non-diabetic group. And then after 8 weeks, right, the researchers stopped giving the insulin already because due to this hypoglycemia, okay? And that is when, there is normal glucose level will actually maintain for the next 7 weeks. So researchers have concluded that blood sugar in diabetics can be controlled by taking cactus daily with a dosage of 1 mg over kg per body weight. All right. And on top of that, actually, cactus contain more than 10,000 phytochemicals that can promote metabolism, decrease triglyceride levels, prevent high blood sugar level, and speed up wound healing. And cactus has also always been considered as highly nutritious. And now it has also been further shown that it can help to stabilize diabetics' blood sugar level. And the effect is more obvious if this cactus is taken daily for a long period of time. Okay, so let's take a look at the next superfoods for diabetes. That will be ginseng. So there is a study that involved both type 2 diabetic and non-diabetic participants who received these 3-gram doses of ginseng. So both the diabetic and non-diabetic participants, right, who consumed this ginseng had blood sugar level that were about 20% lower, which is a very significant decrease than those who did not consume this ginseng. So the study have concluded that ginseng helped to increase the cell's sensitivity to insulin and also help to increase the actual secretion of insulin. Okay, and then let's take a look at these superfoods as well. Cordyceps mycelium, maitake mushroom, shiitake mushroom, and ABM mushrooms. Okay, so all these plant food have a variety of polysaccharides. Okay, and it can actually help the body's to better enhance the production and activity levels of the natural killer cells to prevent infection and cancer. Okay, and then next up would be blueberries. Okay, blueberries is a very rich source of natural antioxidant. It has these anthocyanins, okay, which is a very powerful antioxidant that has retinal protective properties that is very good for the eyes. Okay, besides that, because of its antioxidant, it can help to boost the immune system and help prevent certain types of cancer. Like just now, from what you have heard from my sharing till now, we noticed that, diabetes indeed is a killer disease that can have many negative effects on many parts of the body, okay, which comes with many life-threatening illnesses such as heart disease, stroke, kidney failure, retinopathy, which is lead to blindness and also limb amputation. So these not only incur high medical costs, but it's also a sort of mental distress to the patient as well, especially in today's society with an aging population and an increasing high standard of living, right? We should choose not to get sick in order to be able to live a healthier and a happier life. So I call on everyone to really understand and practice the correct ways to prevent and so-called reverse diabetes. Okay, so according to nutritional immunology, in fact, to prevent and reverse diabetes can be actually very simple. These 5 pointers, okay, that you should keep in mind and to practice it on a daily basis. All right, so first one is eat more fiber-rich food. Okay, so fiber-rich food can help to lower blood sugar level. Okay, and for those who already have type 2 diabetes, okay, the chance of recovery is very high with a daily intake of also moderate amounts of cactus and ginseng as well. And it is also very important to maintain a healthy body weight because according to the diabetes prevention program, losing even a few pounds can help to reduce the incidence of type 2 diabetes because it allows the body to be able to use insulin more effectively. There is actually an experiment on these 3,234 people, at high risk of developing diabetes. So they actually opt for a lower calorie diet and also exercise. And this actually helped to reduce the body weight by 5 to 7%, thereby actually delaying or even preventing the occurrence of type 2 diabetes by 58%. So next will be physically active, moderate and regular exercise, even just walking for about 2.5 hours a week and doing more weight training, because this resistant exercise can help to reduce fats in the body and allow the body to be able to effectively use the insulin, which can prevent and reverse diabetes. Okay, and do not smoke. Okay, because nicotine stimulates the body to produce more triglyceride, leading to insulin resistance. So if a smoker cannot produce more dose of insulin, that means, this person will not be able to control his blood sugar level well as well. So to be safe, do not smoke. All right. And then another important point is to really get sufficient rest, because lack of sleep can interfere with insulin sensitivity. Okay, so there is this study on sleep suppression in healthy young adults for 3 days. Okay, not sleeping enough for 3 days. Just 3 days, it have found that, the participants' glucose tolerance actually decreased by 23%, which proved that lack of sleep do increase the risk of developing type 2 diabetes. And because of lack of sleep, right, our central nervous system become more active, which in turn inhibit the pancreas from releasing enough insulin to break down sugar in the body. So, as long as we practice these 5 points, we can definitely prevent the occurrence of diabetes and even reverse it. So with this, I end my sharing here. So I wish everyone to be in good health. Thank you very much.
All right. Let us put our hands together to thank Eileen for her detailed presentation. Yeah, I really appreciate it, because after hearing Eileen talk about how to prevent diabetes, I'm sure a lot of you have heard about all the information inside, because I always tell my friend, okay, only with the correct knowledge, right, then you have the power to prevent things from happening. So that's why knowledge is power. So that's the reason why we need to learn about the correct knowledge. So let's just recap a little bit about what Eileen has mentioned earlier. Do you still remember the 4 types of sugar? Because people thought sugar is only 1 type, but after listening to her, we know for sugar there's 4 types. So, right. If you don't remember what it is, doesn't matter. Check with your friend again who invited you. Then your friend can actually recap with you what are the 4 types of sugar. And also, just how I mentioned about people with diabetic, right? They actually they are really fearful of taking sweet stuff. So after what you heard from Eileen, we know that now the sweetness of the food has nothing to do with no diabetes, right? And it's actually the glycemic index of the food that we need to really worry about. Okay, so just now she mentioned that rice is not sweet, but rice has a high glycemic index. So now you know, right? Knowledge is power. And also she mentioned about the diabetes prevention, the last part. So you guys still remember? Eat more fiber-rich food. Okay, maintain a healthy body weight. Be physically active. Do not smoke, or please stay away from people who smoke, because we don't smoke, but people who smoke. So stay away from them. And lastly, please always get sufficient rest. All right. So okay, now with all of this, have you wondered? So as I also mentioned about the superfood that was there, this like psyllium husk, soy, cactus, ginseng, cordyceps, mycelium, blueberry, blah blah blah. There's a lot of superfood we mentioned. So has anybody actually consuming those superfood actually regain back their health? In fact, tonight we have invited a testimony sharer. Okay, Jasmine, she will actually share on behalf of a friend that. Okay, so what happened to her friend's dad is that, okay, her friend's dad, right, actually has this high blood pressure and also has diabetes. Has also been a diabetic for over 30 years. Now, having high blood pressure and being a diabetic for over 30 years, right? I mean, to a lot of people, this is probably the end of that person. So is there any way her friends there, right, actually able to regain back his health? Now, let's put our hands together to welcome Jasmine to share.
Okay, thank you so much, Charlie. So good evening, everyone. Hello, everyone. So I'm Jasmine. You can call me Jasmine also. Yeah, so today I would like to share the testimony of my friend's father. Yeah, so my friend's father had high blood pressure and diabetes for more than 30 years in the past. Then he fell and injured himself in January last year. And what happened was that it was raining heavily and he accidentally fell into a ditch. However, when he got back to his feet, he didn't feel that the wound wasn't a big issue. So he went home and bandaged the wound on his own. So the next day, following the next day, when my friend accompanied her father for a checkup, the doctor just informed that the wound is substantial and needed surgery to clean up the inflamed part around it. Yeah, let me do the sharing here, yeah. Oh, sorry. Okay, can you see my screen right now? Yes, okay. Okay, yeah, so from the figure, you can see that this is the inflammation part. Yeah, however, her father's fasting blood sugar level was as high as 19 to 21 due to more than 30 years of diabetes problems. And the normal fasting blood sugar level is less than 6 millimole per liter. So if the wound cannot heal after surgery and continues to deteriorate, he will need to face amputation, right? So at that time, her father was very worried. So my friend just bought the cactus, American ginseng, cordyceps, cordyceps mycelium, cactus fruit, and also the oriental raisin tree fruit for her father to consume while receiving the doctor's treatment. So 2 days after the operation, her dad was no longer in a wheelchair and he was able to walk with only crutches. In addition, during the 5 days in the hospital, her father's fasting blood sugar level had dropped from 21 to 6.5 to 7 now. Yeah, which is very close to the normal level. And she let her father continues to consume the above ingredients until May. So during the next medical checkup in the hospital, the doctor told her the good news is that his father no longer needs to take the high blood pressure drugs. Yeah, so really grateful that through understanding nutritional immunology, it helps regain her dad's health. Yeah.
Yeah, thank you, Jasmine, for helping to share your friend's dad's testimony. So just now you mentioned that her dad took some of the ingredients, right? Can you further elaborate where is she taking all these ingredients?
Yeah, sure. Yeah, let me share my screen now. Okay, so these precious ingredients can be found in Elite Global's complete nourishment series. So these are the 6 products in total, including Rhapsody, Rosy Thyme, Soy Green, Berry Beet, Raisin Tree, and also Immunity. So her dad consumes 100 milliliter of Rhapsody and Rosy Thyme daily, and 3 sachets of Immunity, dividing it to 1 sachet each in the morning, noon, and also evening. Yeah, and 1 sachet of Soy Green and Berry Beet and Raisin Tree every day. So by consuming in higher quantities, her dad has regained his health. Yeah, so really grateful for it. Yeah.
All right. Really, thank you, Jasmine, for sharing testimony and also pointing to where exactly can we actually find the food that her dad actually took to regain his health from diabetes. And also, after I heard you mention after taking the complete nourishment series, his dad don't have to take any more of the high blood pressure drugs, right? Yeah, which this is incredible. I'll put it this way, yeah, because in the medical way, normally when people take this kind of those high blood pressure pills, they have to take it for life. That's what the doctors always say. Yeah. So now really congratulations to your friends, yeah, for winning back his health. Okay. In fact, I have to bring attention to this disclaimer, right? And it goes like this. Okay. Elite products are plant-based food, which are very beneficial for health maintenance. However, Elite does not advocate any form of self-diagnosis or medical treatment. If you have any medical condition, please seek professional medical help. Okay. Now, in fact, it has come to the next segment, which is also my favorite segment. Is the Q&A, whereby you ask the question and we answer for you. So I'm sure that throughout the whole presentation, okay, you probably have a lot of questions that you might want to understand a bit further. So if you do have any questions, okay, take this time to quickly raise a question to the chat box, or you can actually unmute your mic and speak directly to the mic. Okay, let me just look at the chat box, because today there's a lot of chatting going. Yeah, a lot of chats and all these things. Yeah, they are very excited when Eileen is presenting. Yeah, because we learned a lot of stuff. Okay, in fact, I saw. Wait, hang on. Okay, I saw yeah, there's a question here. They say, hi, thanks for holding today's Zoom session. Okay, as mentioned in the testimonial sharing about complete nourishment series, is it necessary to start with the complete set? Okay, very valid question. Yeah, because just now mentioned about taking complete nourishment series. So now this question is asking, is it really necessary to take? Okay, right. So anybody in the Q&A committee, right, can actually help to answer this question from this friend.
Hello, hi Charlie, I'm Aina. I can help in answering to this question.
Thank you, Aina.
Okay, I have a few slides over here. Let me share my slide. Okay, before I start, right, I have a questions over here. Does anyone know where can we find the best doctor in the world? Actually, I have asked these questions to many of my friends, and some of them told me that the best doctor in the world is in USA, and some of them told me is in China. So let me announce the answer to you. The best doctor in the world is none other than our own immune system. Our immune system includes tonsils, appendix, lymph node, and more. And shown over here, when our immune system is healthy, it can perform these three functions, which are to defend us from viruses and bacteria, cleanse the toxins and waste from our body, and repair the damaged tissue in us. To be healthy, we must have a healthy immune system. A healthy immune system means that we need to have the correct and balanced nutrients in order for us to be healthy. Of course, in addition to these correct and balanced nutrients, we also need to have these three important points as well. Enough sleep and rest, appropriate exercise, and a stable mood. When we have these 3 points, right, together with the correct and balanced nutrients, definitely we could achieve a healthy body. So what are the main reasons that cause cancers or chronic illnesses? One of the reasons is our diets and lifestyle. The food that we consume, like the animal proteins, the hormones that come from the meats and seafood. Then also when we are feeling stressed or eating foods with chemicals in it, like the food coloring, preservative, MSG. So what nutrients that can help to fight against all these? The answers is obvious over here, the phytochemicals. We can find these phytochemicals in cactus, as it is contains more than 10,000 phytochemicals. So for cactus, right, it can strengthen our immune systems to defend against various bacteria and virus attack, able to neutralize hormones and reduce risk of cancer, stimulate strong immune defense against tumors, speed up wound healing, and prevent scar. The second one is the free radicals. It is all around us. Free radicals can cause instabilities to our DNA and may lead to cancer. As you know, the free radicals exist in the polluted air, as shown over here, toxic from the industrial processes, cooking from smoking, high heat cooking, UV ray, our body metabolites. The effective nutrients to fight against these free radicals is antioxidants. It prevents these free radicals from causing mutations to our DNA, slow down the aging, promote cells repair, and enhance collagen productions in our body. When we can find these high antioxidants from plants fruit like cranberry, rose, acerola, cherry, cattle fruits. Next is our environment. the radiations, virus, and these are cancer-causing agents in our toiletries and household products. The nutrients to fight against all these issues is polysaccharide. It can increase the natural killer cells to destroy existing cancer cells and viruses by 38 to 49 times, prevents healthy cells from mutating to cancer cells. So when where can we find this polysaccharide? Actually, we can find them in the mushroom family, like maitake mushroom, shiitake mushroom, ABM mushroom, cordyceps marcellin. Okay. So Elite Global has gathered all these very precious ingredients for us in our complete nourishment series. It contains these 6 items, as you can see over here. Immunity, which is very high in polysaccharide. Rhapsody, which contain more than 10,000 phytochemicals. Then Rosy Thymes, it is very high in antioxidants. Followed by this soy green, which is a complete meals replacement, high in protein and fiber. Berry beets that can nourish our hearts and liver to keep them strong and healthy. Raisin tree can protect our liver, boost our energy, and improve our concentration. Therefore, the Complete Nourishment series is the best options to nourish our entire body. So, different people have different physical conditions. However, our cells survive for a period of 90 to 180 days, meaning to say that they will have to take at least 3 months for our body cells to regenerate. So it is important for us to consume the products for at least 90 days before we can see the result. Since we are not doctors, we are unable to diagnose illnesses. Some serious illnesses may caused by a malfunctioning immune system. If we consume the product with the thoughts that when our leg hurts, we should treat the legs, and when we have headache, we should treat our head, it won't be effective. So even for myself, right, actually I started with the Complete Nourishment series. If we want to achieve our ultimate goal for our health, then we should start with overall Complete Nourishment series. I hope that I have answered to these friends' questions. Thank you.
All right, thank you, Aina, for helping to answer this friend share. I think the person name is Share, asking this question. So I believe with Aina's answers, I'm sure that you now know why we need to start off with Complete Nourishment series. Based on what Aina mentioned just now, because the environment, the lifestyle, diet and lifestyle, the environment and the free radicals that we're actually facing every day. That's the reason why we need to have these products to start off. We need to have a lot of phytochemicals, a lot of antioxidants, and a lot of polysaccharides every day to fight off all these harmful chemicals that we actually face every day. So now let me see, right? Are there any questions that you guys have? I mean, if you do have, right, please quickly take this time to raise a question, yeah, so that we can actually answer for you. Because usually when we attend such a presentation, we really have a lot of things going through in our mind, because it's probably something new to us. And yeah, that's why if you ask, then you get a chance for us to answer for you. Looks like, but then again, looks like, yeah, I think I don't see any question being posted in the chat box. So, okay, with this, let me close off the Q&A segment. Okay, thank you, everybody. Okay, now let's move on to the next segment, which is the announcement.